Parkinson Disease, a genetic disorder research project by Juan Fernandez and Oliver Jannetta.
Introduction. The disorder we have chosen has several different names, such as Parkinson disease, Parkinson's disease, or PD. There are 8 different types of Parkinson's disease: primary Parkinsonism, secondary Parkinsonism, drug-induced Parkinsonism, vascular Parkinsonism, normal pressure hydrocephalus, cortical basal degeneration, progressive supranuclear palsy, and multiple system atrophy.
Definition of the disorder. What happens to the body? What parts of the body does it affect? Parkinson's disease is a degenerative and progressive disorder. It affects nerve cells in the brain called substantia nigra and basal ganglia. These nerve cells are responsible for relaying messages that plan body movement, as well as producing a neurotransmitter called dopamine. This disease affects these nerves directly, creating a lack of dopamine affecting body movement. Dopamine is essential for motor control. When 80% of dopamine is lost in the body, the main symptoms of Parkinson's disease begin to appear. Parkinson's disease also causes high levels of a neurotransmitter called glutamate to appear as a result of the lack of dopamine. Description of the symptoms. Possible effects on the body. Symptoms of this disease may vary depending on the person. The most common symptoms are bradykinesia, which constitutes impaired dexterity, slowness of movement, decreased blinking, and an expressionless face. Tremor at rest, which includes involuntary shaking that decreases with purposeful movements. Rigidity, as a result of involuntary increase in muscle tone. And postural instability. Patients may experience a sense of imbalance. Some additional symptoms which are not as common include a shuffling gait, stooped posture, depression, constipation, as well as difficulty swallowing, sleep problems, and a lowered voice volume. What happens in the body to cause the disorder? Despite many years of research, doctors are not sure of the exact cause of Parkinson's disease. As mentioned before, this disease affects 2 areas of the brain called the substantia nigra and basal ganglia. These areas are in charge of making a chemical called dopamine. Dopamine is a chemical neurotransmitter that sends signals to the rest of the body for motor control. As the cells from the substantia nigra and basal ganglia die and the dopamine level drops, body movement becomes impossible to control and Parkinson's disease symptoms begin to appear. Although doctors are aware of what happens to the body to cause this disease, scientists do not know the specific cause for the death of cells in the substantia nigra and basal ganglia area of the brain. Is Parkinson's disease a result of a genetic mutation? Yes. Parkinson's may be caused by a mutation on the LRRK2, PARK7, PINK1, PRKN, or SNCA gene. Heterozygous substitution in the PRKN gene may increase the risk of PD manifestation. More information on the mutation that causes the Parkinson's disease will be provided further on in the video. Multiple factors are believed to trigger Parkinson's disease, such as serious head injuries, Agent Orange, a chemical used to destroy trees and crops in the Vietnam War, certain chemicals used in farming such as insecticides, herbicides, and fungicides, some metals and chemicals used in factories such as manganese, lead, and trichloroethylene, and age can cause Parkinson's symptoms to begin to appear. How is Parkinson's treated? Medications. According to the University of Cincinnati Department of Neurology, the following medications may be used: salicyline and rasgilin, to conserve dopamine in the brain by blocking the action of MAOB, an enzyme which breaks down dopamine, a neurotransmitter. These medications also have an antidepressant effect. Cimetril is used to block the action of glutamate, increasing dopamine production. Mirapex, Requip, and Apoxin introduce agents that simulate the behavior of dopamine. Levodopa and cardamopa combined can reduce movement problems of tremor. Cardamopa ensures that levodopa is converted to dopamine in the brain and not in the intestines. Tolcapone and entacapone improve the delivery of levodopa to the brain by blocking an enzyme named COMT. COMT breaks down dopamine in the digestive system. Surgery. When medications are ineffective in reducing the symptoms, surgical procedures may prove helpful. Deep brain stimulation is a surgical procedure where a device similar to a pacemaker is inserted in the brain to stimulate brain areas responsible for body movement. This device is attached to a stimulator under the skin of the chest, and electrodes are placed in different areas of the brain. When turned on, the stimulator sends electrical pulses to block the nerve signals that cause the symptoms of the Parkinson's disease. Can Parkinson's disease be treated through gene therapy? Philip G. Kuhn, Bernard L. Schneider, and Patrick Aebischer explain in an article that PD is a progressive, long-lasting neurodegenerative disease that is not adequately treated with pharmacological approaches. Part of the gene therapy strategies aim at increasing the efficacy and at reducing the side effects of the current pharmacological and surgical treatments. Our understanding of the genetic causes of PD has made considerable progress during the last decade. Consequently, several strategies based on the delivery of neuroprotective genes to the basal ganglia nuclei are currently investigated to possibly halt disease progression.
How is the disorder diagnosed? There are no objective tests done to determine if a patient has Parkinson's disease, such as a blood test or brain scan. Rather, the doctor takes a medical history and performs a neurological examination. During this examination, the doctor will analyze movement, coordination, and balance. The doctor will also look for any tremors or fast repetitive movements of the finger. There will also be a mental test associated with the neurological examination. Patients will be asked to repeat numbers back or to describe a place. Since there are no specific tests that check for Parkinson's disease, the rate of misdiagnoses are very high. Approximately 25% of diagnosed patients are incorrect. Genetic counseling is an option. Since Parkinson's disease can possibly be inherited by recessive or dominant genes, genetic counseling is strongly encouraged. Who likely has the disorder? Parkinson's is more common in men than women. Men are more susceptible to Parkinson's disease because males have a greater exposure to head trauma. Since Parkinson's is a progressive disorder that affects several parts of the brain, head trauma can increase the probability of an individual to develop this disease. Parkinson's affects 1 in 100 people over the age of 60. People with more advanced ages are more common to develop the disease because Parkinson's develops slowly over years. How is the disorder inherited? Parkinson's disease has an unknown inheritance pattern. Depending on the specific gene that it exists on, the disease can be autosomal dominant or autosomal recessive. Autosomal dominant inheritance is when an individual can inherit the trait from only one parent. Usually that parent containing the dominant gene expresses the trait. Autosomal recessive inheritance is when both parents contain the recessive form of the gene, but do not necessarily express the trait. In order to inherit the trait, 2 copies of the recessive gene must be present. According to the U.S. Department of Health and Human Services, The inheritance pattern differs depending on the gene that is altered. If the LRRK2 or SNCA gene is inherited, the disorder is inherited in an autosomal dominant pattern, which means one copy of an altered gene in each cell is sufficient to cause the disorder. In most cases, an affected person has one parent with the condition. If the PARK7 or PINK1 or PRKN gene is involved, the Parkinson's disease is inherited in an autosomal recessive pattern. This means that both parents would carry a copy of the affected gene but do not show any signs or symptoms of the disease. Since there are several forms of Parkinson's disease, it can be also sex-linked. However, scientists believe that majority of Parkinson's cases are caused by a genetic factor combined with exposure to one or more environmental neurotoxins, such as pesticides.
Facts about the Parkinson's disease. Parkinson's disease is named after Dr. James Parkinson, a British surgeon who discovered the disease in 1817. Approximately 4 million people worldwide suffer from Parkinson's disease. 50,000 new cases are diagnosed each year in the United States. Around 1 in 20 people are diagnosed under the age of 40 years. Treating patients with Parkinson's disease costs the United States around $25 billion a year. The average patient will need $2,500 worth of medication each year. Therapeutic surgery may cost up to $100,000. Dopamine is associated with mood and movement. Around half of Parkinson's disease patients suffer from depression, and approximately 40% suffer from anxiety.